If you feel gassy all the time, it's easy to assume something is seriously wrong. But in many cases, constant gas comes from a few repeatable triggers, things you do every day without noticing. And the tricky part is this: gas isn't only about what you eat. It's also about how you eat, how fast things move through your gut, and what your gut bacteria do with whatever reaches them. Some gas is normal. The problem is when it's frequent, uncomfortable, or paired with bloating, pain, or embarrassing urgency. The goal here is simple: help you spot the most common, most overlooked causes, so you can test small changes and see what actually helps. We'll go through 9 triggers. Each one is common, and each one has a practical way to think about it. And along the way, I'll point out a few red flags that deserve a medical check. Let's start with the easiest one to miss. Moving to slide 2. Trigger number 1 is swallowed air, also called aerophagia. It sounds minor, but it can add up fast. You swallow more air when you eat quickly, talk while chewing, drink through a straw, or chew gum. Carbonated drinks can add to it too, because you're taking in gas directly. Even habits like frequent throat clearing, anxiety-driven shallow breathing, or sucking on hard candy can increase air intake. That air has to go somewhere. Some comes back up as burping, and some travels through the intestines and exits later. If your gas feels worse after meals, and you also notice frequent belching, this is a strong candidate. The experiment is straightforward. Slow your meals down. Put the fork down between bites. Try a week without gum, straws, and carbonated drinks. If symptoms drop noticeably, you've found a major lever. If not, don't worry. There are several other common triggers that create gas from inside the gut, not just from swallowed air. Moving to slide 3. Trigger number 2 is a mismatch between your digestion and certain carbohydrates. This is where FODMAPs come in, fermentable carbs that some people don't absorb well in the small intestine. When they aren't absorbed, they reach the large intestine, where bacteria ferment them and produce gas. This isn't a character flaw. It's chemistry plus biology. Common examples include certain fruits, wheat-based products, onions, garlic, legumes, and some sweeteners. The pattern is often bloating and gas that builds over a few hours, not instantly. And it can vary depending on portion size and stress. The practical approach is not to permanently fear foods. It's to identify your biggest offenders. Many people do best with a short, structured elimination and reintroduction, ideally with a clinician, because the goal is the least restriction needed. If you notice that healthy, high-fiber meals reliably make you gassy, fermentation sensitivity is worth considering. Next, let's talk about one specific carb issue that's extremely common: lactose. Moving to slide 4. Trigger number 3 is lactose intolerance. Lactose is the sugar in milk. To digest it, your small intestine needs enough lactase enzyme. Many adults produce less lactase over time, and the result is simple. Lactose passes through undigested, bacteria ferment it, and you get gas. Often you also get bloating, stomach noises, and sometimes loose stools. The timing is usually within a few hours of dairy. What makes this tricky is that it's not always obvious which foods contain lactose. Milk and ice cream are obvious, but lactose can also show up in soft cheeses, yogurt depending on the type, creamy sauces, and even some packaged foods. The easiest test is a clean 2-week break from lactose, then a careful re-challenge. Some people tolerate small amounts, or do better with lactose-free dairy, or with harder-aged cheeses that contain less lactose. If dairy seems to be a consistent trigger, this is one of the most actionable causes to confirm. Moving to slide 5. Trigger number 4 is fructose malabsorption. Fructose is a natural sugar found in fruit, honey, and also in many sweetened foods and drinks. Some people absorb fructose poorly, especially when it's in higher amounts or when it's not balanced with glucose. When fructose isn't absorbed well, it becomes fuel for gut bacteria, leading to gas and bloating. A common pattern is symptoms after certain fruits, fruit juices, or sweetened beverages. And because fructose is often seen as healthy, people may increase it while trying to improve their diet, then wonder why their stomach feels worse. The practical move is to look at your biggest fructose loads. Juice is a big one because it concentrates sugar without much fiber. Large servings of certain fruits can do it too. You don't need to avoid fruit forever. You're looking for your tolerance threshold and the forms that work best for you. Next up is a trigger that hides in plain sight. Moving to slide 6. Trigger number 5 is sugar alcohols, like sorbitol, mannitol, xylitol, and erythritol. They're common in sugar-free gum, candies, protein products, and diet desserts. The reason they cause gas is straightforward. Many sugar alcohols are only partially absorbed, so they pull water into the gut and then get fermented by bacteria. That combination can mean gas, bloating, and sometimes urgent diarrhea. People often miss this trigger because the serving size looks small, or because they're consuming it across the day, one gum here, one snack there. If your gas feels chaotic and unpredictable, and you use sugar-free products regularly, check ingredient lists for these names. A clean experiment is easy. Remove sugar alcohols for 1 to 2 weeks and see what changes. If you're sensitive, the difference can be dramatic. If nothing changes, you can move on confidently. Next, let's talk about fiber, because more fiber isn't always better at first. Moving to slide 7. Trigger number 6 is a rapid increase in fiber, especially certain types. Fiber is great for many people, but your gut bacteria need time to adapt. When you suddenly add a lot of beans, bran, raw vegetables, or fiber supplements, bacteria may ferment more aggressively, producing more gas. This can happen even if the foods are objectively nutritious. The key detail is pace. A gradual increase often causes far less discomfort than a sudden jump. Hydration matters too, because fiber without enough fluid can slow things down and worsen bloating. Another detail is fiber type. Some people tolerate soluble fiber better than rough, insoluble fiber. If your gas started after a clean eating push, a new supplement, or a big change in meal composition, this is a likely explanation. The practical fix is not to quit fiber. It's to scale back slightly, then increase more slowly over weeks, while tracking which sources feel easiest. Next, we'll cover constipation, because trapped gas is still gas. Moving to slide 8. Trigger number 7 is constipation or slowed transit. When stool sits longer in the colon, bacteria have more time to ferment leftovers. Gas can build up, and because things aren't moving smoothly, that gas can feel trapped. More pressure, more bloating, and more discomfort. Some people assume constipation means no gas, but the opposite can happen. A clue is infrequent bowel movements, hard stools, straining, or the feeling of incomplete emptying. Another clue is that gas improves after a good bowel movement. Common contributors include low fluid intake, low activity, travel, and certain dietary patterns. The focus here is regularity, not perfection. Many people do well with consistent meal timing, adequate water, and gentle daily movement. If constipation is persistent or new, it's worth discussing with a clinician, especially if there's blood in stool, unexplained weight loss, or significant pain. Next, we'll look at the flip side, when things move too fast. Moving to slide 9. Trigger number 8 is diarrhea or rapid transit. When food moves too quickly, digestion and absorption can be incomplete. That means more carbohydrates reach the colon, or bacteria ferment them and create gas. Rapid transit can happen with stress, certain infections, some food sensitivities, or conditions like IBS. The pattern here is often gas plus urgency, loose stools, and a feeling that your gut is reactive. Another piece is that rapid transit can be intermittent, fine for days, and suddenly flaring. The practical step is to look for patterns. Does it happen after specific meals, after coffee, during high-stress periods, or after very high-fat foods? Keeping a simple symptom log for a week can reveal a lot. If diarrhea is frequent, wakes you from sleep, or is associated with fever, dehydration, or blood, that's a reason to get medical input. Next, we'll cover a big, commonly missed driver of gas: imbalances in gut bacteria, including SIBO. Moving to slide 10. Trigger number 9 is bacterial imbalance, especially when bacteria are active in the wrong place. Normally, most fermentation happens in the large intestine, but in small intestinal bacterial overgrowth, often called SIBO, bacteria are more abundant in the small intestine, where they can ferment food earlier than expected. That can create gas, bloating, and discomfort soon after eating, sometimes within 30 to 90 minutes. People may also notice nausea, changes in stool, or feeling full quickly. It's important to be careful here, because many issues can mimic SIBO. and self-diagnosing can lead to unnecessary restriction. If your symptoms are persistent, meal-related, and not explained by obvious triggers like lactose or sugar alcohols, it's reasonable to discuss testing with a clinician. The big takeaway is that constant gas isn't always too much gas. Sometimes it's gas happening in the wrong location at the wrong time because of how the gut ecosystem is functioning. Next, let's hit two often overlooked lifestyle triggers: stress and sleep. Moving to slide 11, stress is not all in your head, and it can absolutely change gas levels. Under stress, your breathing pattern shifts. You may swallow more air, and your gut-brain signaling changes how the intestines contract. For some people, stress speeds transit. For others, it slows it down. Either way, fermentation patterns change, and gas can feel more intense because the gut becomes more sensitive to stretching. Sleep plays into this too. Poor sleep is linked in studies to worse gut symptoms in many people, including those with IBS. The practical approach is to treat stress and sleep like real inputs, not background noise. Start small. Try a slower first meal of the day. Add a short walk after eating. Use a consistent wind-down routine at night. These aren't magic fixes, but they can lower the baseline reactivity of your gut, so food triggers become easier to identify. Next, we'll cover another sneaky contributor: certain supplements and health products that create gas as a side effect. Moving to slide 12. A lot of people miss trigger number 10, supplements and functional foods. Some fiber powders, inulin, chicory root, and resistant starches are highly fermentable. That means they can help some people and seriously bloat others. Protein powders and meal replacements can also contain sugar alcohols, gums, or added fibers that increase gas. Even greens powders can be a mix of ingredients that your gut bacteria love a little too much. The pattern is often, you start a new product for health reasons, and within days your gas ramps up. The fix is simple, but not always easy. Pause the new addition and see if symptoms settle. Then reintroduce at a smaller dose or swap to a different formula. If you want to keep using supplements, choose one change at a time so you can tell what's doing what. Next, we'll talk about when gas is a clue to something that deserves medical attention. Moving to slide 13. Most constant gas is explainable and manageable, but some patterns should push you to get checked. Red flags include blood in stool, black or tarry stools, unexplained weight loss, persistent vomiting, fever, anemia, or symptoms that wake you from sleep. Also pay attention to severe pain, a sudden major change in bowel habits, or gas and bloating that steadily worsen over weeks. Another reason to check in is if you have a family history of inflammatory bowel disease, celiac disease, or colon cancer, and your symptoms are new. And if you suspect celiac disease, an immune reaction to gluten, don't remove gluten before testing, because that can make results harder to interpret. The point isn't to scare you, it's to give you a clear line between common trigger and needs evaluation. Now, let's pull everything together into a simple plan you can actually use, without turning your diet into a detective board. Moving to slide 14, here's a practical way to troubleshoot constant gas without guessing. First, pick one category to test for 7 to 14 days, like carbonated drinks and gum, lactose, sugar alcohols, or a specific high FODMAP food group. Second, keep the rest of your routine steady so the signal is clear. Third, track just 3 things: gas intensity, bloating, and stool pattern. You don't need a perfect diary. A quick note once per day is enough. If you improve, reintroduce carefully to confirm it wasn't a coincidence. If you don't improve, move to the next likely trigger. Also remember the how, not just the what. Slow meals, smaller portions of fermentable foods, and consistent sleep can change the outcome even when the ingredients stay the same. If you want one simple baseline, aim for regular meals, adequate hydration, and a daily walk after one meal. If this breakdown helped, consider subscribing for more clear, evidence-informed health explanations. And I'd like to know, have you noticed your gas is worse with dairy or worse with sugar-free products?